Okay. Hello, everyone. It's nice to be with you again. We have an interview today that is, I'm just so thankful. I'm thankful to God that this person came into my life. Just this past weekend, I was at a biological dentistry conference. It was the conversations that I had with many people were just amazing. But this conversation with Claire Stagg was one of the best. I am just so thankful to have met her, and I am very eager to jump in and have a really good, honest, and very important, critical conversation with her. So, Claire, welcome, Dr. Claire
Thank
Stagg.
you. That was a very warming, touching introduction. Thanks, Maureen.
Oh, it's heartfelt. I think that my two favorite conversations over last weekend were one with you and one with Dr. Anthony Sims, who we also will interview at a later
Yes.
date as well. He had me in tears. You had my heart going and involved all the way. And so I knew once we had just talked for a few minutes that you were a person that had a lot of good to bring to the table, literally to God's good table. we we feel so strongly about the health, mental health and physical health, emotional health of today's young families, the children and all of the obstacles that they have before them. Um, and I'm so troubled with what I'm seeing. So you are the perfect person to address some of these issues. And so before we get started, why don't you tell us a little bit about your background?
So I am a mom. I think that's very important to go
I think
ahead.
that's
We had a little bit of conversation earlier on before we started, and I had my children late in life. I was nearly 40 when I had my first one, and my
wow.
second one 26 months later. So, there's a big fallacy about if you have children late in life, you're supposed to do amnios, you can't have children
Oh,
late in life, naturally, everything. I had mine naturally, no C-section, no drugs, I mean, no epidurals, nothing. Um, I ate very, very well. I followed the Bradley method at that time. I didn't know, I
yeah.
think, really about Western price and that aspect of it before. But one of the things that I wanted to share with you was that I have two books. I think I'll bring them out. The first one we talked about was my little book for children. It's called Captain IFBI on home care, and we talked about story time. But the next big one is called Smile. Smile, it's all connected, whole health through balance, and they're available on Amazon. But don't despair. Help is there. Not to rhyme
Very
too much.
good.
Right. But
I like that.
I think that it's people like you that and I that I believe that we're in certain places at a certain time in our lives, and that we've been through what we've been through so that we can share our experiences with others.
I
And
agree.
so what has happened is that in my books as a mom, um, I had been on a journey for many, many years, but the main reason this big book is out is because my firstborn fell and hit her chin. And any person who has a scar on their chin with a joint disorder usually means that they'll probably end up having to have surgery. And I didn't want that for my firstborn. And so I went on this track to pursue information, to be able to help more people so that other children wouldn't get hurt. So you have in the book there's a flower, if you will. There's a six petal flower. The book is broken down into three parts: the past, the present, the future. And then Weston Price, who is a dear mentor for me because he was a past president of the American Dental Association, which very many people, and I mean that a lot, do not realize or recognize. He's
Right.
brought an amazing amount of science about infections and root canals and on focal points and all that to the table. But he's also gone ahead and brought out a massive amount of data about nutrition and how growth and development occurs. And his book, Nutrition and Physical Degeneration, it's backwards. So that one was one of the very important references for me to show that back in the 1890s, he was an orthodontist, and he actually left and closed his practice in New York City because he kept finding that all these children had no more room in their mouths for their teeth. And so he
Right.
set out on a journey to figure out what was going on. And he went and traveled to indigenous tribes in various continents and countries to try to figure out why and how they were eating differently, or what they were eating that would allow them to have these gorgeous smiles and airways, because they could
Yes.
breathe through their noses. All right. So, what I'd like to assuage your despair with is to know that it's going to take education. It's going to take changes in the powers that be, that
Yeah.
reverse the food table, the
Yes.
pyramid of the food table.
Absolutely.
All
We
right.
flip it.
So, all right. So there's good, but it's people like us, been there, down there, who've been in the trenches, who've had these issues, who've come out. There are going to be a lot more people who realize that they've had to help themselves get themselves out of the trenches. It's people and issues like that that are going to bring more and more and more and more light. And all of a sudden, everybody's going to go like, wait a minute. That doesn't sound right anymore. What's going on? I don't think that's right. And that's what it's going to take. It's going to take a drop, plus a drop, plus a drop, plus a drop to make the pendulum swing the other way. And I think that's where we're going. We're headed pretty darn close. I think it's already swung, but it's not loud enough yet. So I think we're there.
I think people are beginning to wake up, and they need to. As I shared with you privately, I just am so upset about what I'm seeing in children today, from the narrow faces and the asthma and the this disorder, that disorder, obesity, type 2 diabetes, mental health problems, learning disabilities. And this was not a problem 100 years ago.
Correct.
It wasn't a problem when I was a young person in high school. But in Dr. Price's time, he recognized that things were changing.
Right. Right. And it stems not only because of nutrition mostly. Well, of
Hmm.
course, you have all the environment, smogs and everything, but it really has a lot to do with nutrition. So, to be
Yeah,
honest, I think not only are we talking about the nutrition of the child, but we're actually talking about nutrition of the parents at least 2 years pre-pregnancy. You've got to
right.
have fertile soil to build the farm to have a plentiful and harvest. So it's the same way you need to detox and clean your bodies, be mercury free, be as clean as you can, defog somewhat,
Yeah.
so that way you can eat and inform what nutrition's best for you pre and during pregnancy, and then have a healthy birth, all right, which makes all the difference in the world, and
Yes.
then be able to nurse. And I think no shame, no blame, no issues for people who can't. It's okay. I had issues too, but I persevered, all right. But I think it's really important, because once you go ahead and you have that nursing effect, you actually have the child's rhythmic palatal suction, if you will, actually forms the palate. Well, the palate is the roof of the mouth, is the floor of the nose. So now that nasal passage airway is going to open up and develop better. And then it's a like chicken and the egg. So now we have a proper pharyngeal airway also. The child will grow and develop into broader faces. All right. So all that's tied in. And then as you continue, as they grow, then you end up having a much better food growth and continuation. I'm going to give you a funny story. I had at the time, back about 10 years ago, I was big into the DNA appliance therapy. And I had one family who had 3 children here in Orlando. They've moved since. The first had a narrow palate. I mean, I swear, she couldn't even put her thumb in there. It was so narrow, right? The second child, they had just started, maybe a year or two. So he was still pretty young when they started the Western Price method of eating. The
Mm-hmm.
third child was totally had pre-pregnancy, during pregnancy, after pregnancy, was pure Western. In the same family within a period of 10 years between the first one and the last one, that totally different physiology of their faces and the anatomy. It was really cool. It was so cool. I said, "God, you guys should be in a textbook." And I think I have a picture of all three of them. I was like, send me a picture, because this would be something that you know, Weston Price should have to show within
Yeah,
the same, just like he has in his book.
he
Remember in
does.
his book? And in his book, and I actually had my artist draw that. You have the two sisters, remember? The two
Mm-hmm.
sisters, one who went to the village, ate like the villagers, the white man with his sugar and processed foods. Back then, they were still sort of semi-processed. Then you had the one sister who stayed in the village. And then you put them side by side. One looks old and haggard, bless her heart. And the other one looks very young and good skin and broad smile and everything. Well, the one who's got a super narrow arch, all right, and looks older is actually the younger of the two sisters. And
That's
it's like, oh
crazy,
my God,
isn't it?
I know, right? Yeah.
Yeah.
So it's like, okay, that's ready to show you within the same generation, things can be so different.
Yes. I remember also that he has a photo of brothers from Scotland, I believe, side by side, and one had gone to the town and one was still in the village. So they were eating one, the native foods, which would have been
Right,
seafood and oats, and their diet was pretty limited.
right.
Um, and the other went to town and had the sugar, the jams, the jellies, the canned vegetables, and that kind of thing. Just that much made a massive difference, as with these
Right.
sisters. That should speak volumes to us. And today our food is so highly processed, so devoid of nutrients and full of sugar and toxic seed oils and other things. What I hope that parents will wake up to, or prospective parents, is that you cannot you cannot expect to have healthy children when you're eating a highly processed diet. It can't happen, can it?
Yeah.
So
What makes it sad too, if we're gonna be on a sad tangent, is that they make the good food inaccessibly financially. If you
yes.
think about it, organic food the way that it should be, I mean, RFK Jr. was saying it, there's no reason why there shouldn't be organic foods everywhere. You know, if
Hmm.
you go ahead and you till your soils and you do whatever that you need to do without all the pesticides and the glyphosates or whatever. I know this is sounding way political and everything, but at the same token, it's just common sense. You know, if
Hmm.
you go ahead and you have a garden at home and you tend it, then you're going to go ahead and have the right results. If you go ahead and you have, for example, just this came to mind. You have a plant, all right? God knows how many little YouTube videos there are out there. You give the same two plants, one distilled water, I mean, one water or one microwaved water. The microwave water plant dies. Well, it's the same sort of thing if you end up having a nutritionally devoid, a diet that's devoid of nutrients, period. But again, I'm going to share a sad secret with you, is that physicians aren't taught anything about nutrition,
Right.
just like they're not taught anything about airway and sleep at schools. Because in my book, I have interviews with professors at universities, and they'll tell you, you know, I'll come to your school or university and teach about sleep and airway. Oh, we don't have time. There's no time in the curriculum. We have such a hard time even trying to get through what we're doing. Not one mention of nutrition, not one mention of airway, nothing. And if you can't breathe, by the way, all those things that you said about those children, obesity, diabetes, hypothyroidism, and cardiovascular disorders, ADHD, attention deficits, all those things are comorbidities of sleep apnea, obstructive sleep apnea.
Oh
So,
yes.
yeah, so
And
they go hand in hand. If you can't breathe, you're not going to thrive.
we cannot breathe because our airways are obstructed or crowded
Correct.
because the roof of our nasal cavity is arched instead of flat. Our faces are
Correct.
narrow instead of wide, and that all stems from nutrition.
And back
Yeah.
here it's all clogged up. There's a little video on YouTube, and I'm gonna do the little sound like how it sounds. It's called Airway and TMG. All right. It's 3 minutes long. Airway and TMG, 3 minutes long. It is one of the most amazing um, little videos that anybody can watch. It's so educational, so educational. I have every single patient watch it. It's on my website too if you get lost and you can't find it. Healthconnectionsdentistry.com. And those 3 minutes show you basically the process between breathing through your nose. And remember, when a child nurses, it actually creates the way because the nasal passages, the breath, when the lips are formed and the palate and that movement, peristaltic motion I was showing you, the nasal passages are actually created much better too because they are obligate nasal breathers when they're nursing. The only one who can breathe and eat at the same time is a newborn, just so you know.
Mm,
All right. And then
that's
eventually,
interesting. Yeah.
it just becomes where they have to, eat separately because it's the same passageway. But when you go ahead and you look at the video, it starts off explaining how to nurse and how to eat, etc., how to bring the bolus back, and then how to swallow. But if you can't breathe through your nose because you have allergens or whatever, so again, poor nutrition, you end up having
Mhm.
nasal congestion or tonsils that are very, very swollen or adenoids that are very swollen. Well, they're doing their job, right?
Yes.
They're the safety nets of bacteria and the all the irritants that are there that your body's fighting so that they don't bother you. All right. And so now you have these massive obstructions. Well, the only way you're going to be able to survive is breathing through your mouth. And now we have low tongue posture, and then the cycle just viciously occurs. Now, with time, you have all the structural changes that occur because you can't breathe. So you're going to have forward head posture. Your jaw is going to go up and back. You have a joint disorder, a disc displacement. You can't breathe. You're going to clench and grind. You wear and tear down your teeth, and then your jaw goes back even more up and back, and then now you have a disc displacement, and blah, 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 blah. So I mean, yeah, you got to breathe
It's a
through your nose.
cascade of
Yeah,
negative effects.
right.
Is there a way? Obviously, we want to prevent these things from happening to begin with, and that's going to happen through nutrition. And I want to circle back to that, the preconception through pregnancy and beyond. But is there a way when you have a child who's already damaged, and it is damage, when you already have a child who has a narrow palate, who has a restricted airway, is there a way to reverse or correct that?
Yeah. Oh, yeah. Many, many different ways. Many, many different ways. So in my book, I sort of divided the whole system, if you will, into 6 sections. You have the structural, chemical, mechanical, functional, emotional, and spiritual. The 6 petal flower, if you will. So
Mm-hmm.
if you go ahead and you have the child that comes in, you've already cited the structural components, narrow palate, and we talked about the tongue and the floor of the mouth, nasal passages are very restricted, etc. All right. Now we also talked about the chemical components where we have the seed oils, the processed foods, the sugar. All
That's
right, the
everywhere.
sugar. All right. All right. And the white flour and the totally baseless foods, right? Okay. So now you're already
Yeah.
starting to check off the boxes. All right. Okay. Well, what are the other issues that are going to happen? You can reverse engineer everything. So when you have a child that comes into the practice in that situation, usually, first of all, a parent has to find me, which they do eventually because I'm the last one. And he's like, "Oh my God, we didn't know this existed. We didn't know." I was researching, which is why it's so important to get the messages out there.
Yes.
But it's the
Mhm.
parent that goes to the bedroom and says, "My kid snores. My kid's still bedwet at 13. My kid
Mhm.
is getting overweight. My kid is on all these drugs." Or there's a really good movie you could go online. All these resources are on my website. But there's another really good movie called Finding Connor. This is a little kid who was
Yeah.
ready to be institutionalized. His parents were at their wits' end, didn't know what to do. Kid was taken to a dentist who found out that he had obstructive sleep apnea. All right. He didn't have ADHD because he was nasty or mean, or he wasn't nasty or mean because he had ADHD. What I'm saying is that he was not functioning because he wasn't getting any oxygen at night. All right. Well, all these kids that we talked about that have all these mental disorders, usually it has to do with lack of airway. So we
Hmm.
talked earlier on about Dr. Sims, all right, who did the Tourette's. Well, it's the same thing. You have a disc displacement, you have a jaw that's up and back. These kids, same thing, usually have a neurological dysfunction. So it's all connected. You can't disconnect one part or the other. It's just that you got to figure out how to zero in on that one little thing that's pertaining to that child. So when the children come into the practice, we do an examination. And I also always ask for a sleep study. When they're that young, they have to go to the lab and get a sleep study because my equipment can only work for children 12 and above to get sleep
Okay.
studies, right? So the whole idea is to see what can we do. So if it's structural, we'll widen their palates up. We can. All right. Weston Price even showed on a young man who was trisomy 21, all right, that
Yes.
everybody had given up on. All right. He showed that when they went ahead and did arch expand, and this is Weston Price, what's that, early 1900s? All
Yeah,
right.
he did.
So
It would have been that this child, I think, was in the late 30s.
all
Wait, he
right.
published, yeah.
So I mean, nearly a century ago, right? Nearly a
Yeah,
century
yeah.
ago, right? Okay. So think about it. This young man totally I don't want and the hindrance is not it was a challenge for the family, you know,
Yes.
somebody that you have to take care of and you have other children and you have to try and make ends meet, etc., etc. But the change after the arch expansion, which to explain to the average person, so you have an arch like this, you expand, you know that the nose is on top. So I'm at the office. I'll show you my skulls. All right. So that's the upper, this is the mid, and this is the lower face. So I always say this is the part that we work on. This part.
Yes.
So when you expand this, all right, the floor of the nose goes ahead and drops. So, but guess what's on the as you go up, you go through the cribriform plate to the brain, but what's above all that? That's the sella turcica, which is a sphenoid bone, and what sits in there? The pituitary gland.
That's what I was
What
thinking. Yeah.
what secretes the growth hormone? Do you understand? So now this child who was incapable of much or not capable of much, rephrase that,
Yeah.
now started being able to be a functional contributor to his family and was, of course, much more proud and confident because he emotionally was totally different and developed in ways. He grew several inches, he grew pubic hairs. I mean, he developed
He
many ways,
developed.
right?
It was
Right,
remarkable.
right.
Remarkable.
So that so you ask, are they and remember too, we change cells in our bodies change anywhere from once a year to some daily, some hourly, some weekly, some monthly, some every 7 years. So you get a new body all the time. All right.
Hmm.
So if you think about it, when you ask me, is there hope for these children? Of course there is. Of course there is. Don't despair. There is hope. You just need to figure out what it is and then zero in. So how I explain it, and all these analogies are in the book. You walk into a dark room, you open a house door, and you walk in and it's dark, it's pitch black, and you stub your toe. So what the heck? What's that, right? You put a little light on, and oh my gosh, the stove is in the hallway. That doesn't belong there, right? And then you, okay, so move on, walk in, it's still pitch black, and then you stub your toe again, and you open up, and then it's the fridge is in the living room. Then you put another little light, and so on and so forth and so on. And by the time all the lights are on, it's like, okay, all the furniture is in different places that it needs to be. So think of the child that comes in and all the little symptoms or signs that you've seen or that we've diagnosed or found, all the little pieces of furniture that are somewhere they shouldn't be, a lot of them are not where they need to be. So not should and need, two totally different things at times, right? So the
Right.
goal as a diagnostician and as a doctor is to go ahead and to sit with a parent and say, listen, you have all these pieces of furniture, your child. What do you want to do with these for the rest of the child's life? Do you want to move them? Do you want to rearrange them? Do you want to get rid of them? Do you want to put them where they need to be? Do you want, how do you want your child to grow? So if you think that you're at the bottom of the rabbit hole with all these dysfunctions, dis-eases, dis
Mm.
um whatever's dysfunctions,
Disorders.
malfunction,
Yeah.
whatever disorders, what is it that you want to reverse engineer? And that's all you need to do. You got to figure out what the pieces of the puzzle are and then figure out how you want to put them back together. So yes, it's just a matter of doing the right sequential ordering of figuring out what they need and how to go about it. Can they all afford it? No, which is why sometimes prevention is the best medicine, always, no matter what,
Prevention is always, yeah.
right?
Yeah, we
And
shouldn't
then
even
so
get to that point.
you don't let the malaises or the dysfunctions happen. And then afterwards, it's a matter of figuring out how long is it going to take to repair everything, to grow
And
back
it
those
can,
healthy. And I do it on adults too, by the way.
I have had a couple of friends who've had major rearranging of their
Right.
facial structure to great
They say
benefit.
they say that you cannot, conventional orthodontists will say that you cannot change a palate, that the skull has grown to its maximum potential at age 9. You cannot expand a palate after age 9. And so they advocate taking teeth out to make room. Well,
Hmm.
quantum physics, if you think about it, you've got a 20 by 20 by 20 cube, and you take out 2 feet each side. Is your cube total metric, square metric going to be less or more? Did you really make space or not? No. You've actually reduced the space that the tongue's going to be able to sit in, that the tongue, it's basically all about the tongue. So
Yeah,
everything's going to collapse thereafter. But the whole idea is to go ahead and to grow and to keep the benefit of the growth and to move on from there. I forgot the trait. I was going to say something about the about that, but anyhow, I got carried away with the cube thing because
well,
people
it's,
get that. People get
yeah.
that to where because there's a big thing. Oh, I know. Sorry. So
It's
people say
okay.
that they can't. This is so important. People say you can't do it after 9 years old. I have an 83-year-old grandma, great grand, that I've expanded with an ALF appliance, an ALF, which is a spider web little wire appliance. It's called Advanced Light Force Functional Appliance, an ALF. So
Wow.
yeah, so I mean, it's like, uh, all right. So basically, that's what I wanted to say. You can help them.
That's very encouraging and important. And I should add that not only can we, but we should, because instead of putting band-aids on symptoms and problems or just accepting that we're always going to need a pill, always going to need this, or always have that problem, we need to try to get the body back to the way that it was designed to be built and function. So, with that, let's step backwards and let's talk about how do young people or young prospective parents, how best should they prepare for conception and for healthy children, just starting from back there, and then let's walk a little bit through what nutrients, what foods we should be eating to produce healthy children.
So I know Weston Price has a big thing, and the Institute now has a big, grass-fed this and this and this and this. But I really believe everybody should do what's best for them,
Okay.
in the
And
sense that, in the sense that whatever works for you as long as it's clean food. So some
clean is
people could be
important.
right. So not processed, not chemical laden, not pesticides, etc. laden, whatever. But Some people are vegan, be it with philosophy or because that's their preference. Some people could be vegetarian. Some people could be pescatarian. I personally don't eat meat. I haven't eaten meat for years. I love my vegetables. I love my fruits. Yes, I'll eat eggs. Yes, I'll eat fish. But it's what works for me. Now, is that if I have a omnivore or I have a herbivore or I have a carnivore, now that's where it gets a little bit complicated because I had a husband at the time who all he ate was meat and potatoes, and I didn't. So, it's hard to cook in a household that eats that way, but it doesn't mean that you can't do it. So
Yeah.
whatever works for you. So for example, I was pregnant, right? I was on a raw food diet. I was eating vegetable. I mean, I was a vegetarian at the time. Man, I craved meat. I got pregnant.
Hmm.
I craved meat. And I guess it was the iron. I just needed meat. And that's what my body did. I just followed what my body wanted and needed. And I
Yeah.
think, I think, I think that's where we lost track of listening to our bodies
We
because
definitely have.
we have this innate system in ourselves, the light within, the creator
Hmm.
source. We have God within. I mean, God tells us, he gave us the recipes, he gave us the food, he told us what to do. It's there, it's out there. You just look at God's word, it's there. The words usurped by mankind, but it's always been there. We just have to listen to our inner voice too, and pray about it, and follow what works best for us, with the understanding that, if you give something that's going to make it thrive, it will thrive. If you give it poison, it's not going to thrive, right?
Now, I follow the analogy that like builds like, and
Mhm.
that if we are to have healthy children, we have to put into our bodies what the child needs to develop. So,
Correct.
so I firmly believe that, especially through pregnancy and childhood, that we need to have clean meats and clean fats. Um, I like to tell people that babies are not vegans. So if you are a vegan mom, your baby growing inside of you or nursing is going to take from mama's body exactly what it needs. So let's put into our bodies those things. So flesh meat builds muscle. Organ meat builds organs and provides other nutrients for the rest of our body. We should certainly be consuming organ meats. Um, the special fats like coconut and olive oil are wonderful fats. Tallow and duck fat are wonderful fats, but also butter or ghee, and just the fat of an animal. I mean, God prized that. That was part of in the sacrificial system of the Old Testament times. The fats, especially the saturated fats around the organs, were revered. God called it the best. So that informs me that in order to build healthy bodies, and it absolutely amazed me constantly as I was having children, that my body could produce another human being.
I know.
It's awesome, isn't it? But we have to put into our bodies what that body needs, or we are operating at a deficit. And if you're having more than one or two children, the child will have a deficit. So that's why we're seeing so many problems with children today, because mom and dad aren't eating good, clean, nutritious food. They're not feeding their children once they're born good. I mean, put a baby on formula from the store, or give them rice cereal when they're 3 months old. Um, expect kids to thrive on baby food and formula, and a very inadequate diet overall. Um, we need to understand that the result of a diet deficient in nutrients is going to produce a child with deficiencies of bodily structure. So is that
Sure.
kind
So, not to be controversial, Maureen.
of, it's okay. I can handle a little.
So, I'm just going to bring up a point.
Okay.
When Western price went did his journeys. All right. And I don't want to create any enemies within the whole establishment, but I just, you know me, I'm kind of like, I'm going to say it as it is. And
Yeah.
I just, because I think outside the box. So let's go back to his journeys. All right. He went on different continents.
Hmm.
Do you think that each tribe on the 6 different continents ate the same food?
That is the fascinating thing to me. One of the fascinating things is they all ate different foods. They ate foods that were in their own environment.
Right.
It was not the same at all from one country to the next or one continent to the next, but he found similarities.
Right. And that is the communal point. And
Yes.
that's the point I was trying to bring across.
Okay.
So very nicely with love, you may believe that all the things that you mentioned, the organ meats and the fats and everything, that may work in your heritage, your culture, your continent. But in another heritage, like those who are in Scandinavia and in
Mhm.
Norway are going to eat totally different than those in Chile and Argentina, right?
Absolutely.
Different, right? So I think the common ground, the common denominator, and I think that's what Weston Price in his heart wanted everybody to understand, is that what's important isn't necessarily, and I say content with the big, super the nebulous content, but it's the quality of what it is that is important.
That
So
absolutely.
so what worked for you may not work for somebody in South Africa, totally not for sure, or the Aborigines, but
Mm.
they all had clean foods, clean water, and clean mind, body, soul, spirits, right? It
Mhm.
was all a trickle down in its purity and its quality. And I think that is the core belief that he really would have wanted us to perpetuate, as opposed to imposing what we think is best for everybody. That everybody should have this or everybody should have that. I don't think really was his core message.
I think what you're saying is the same thing, obviously, that he said and that I would say, and that is that you eat whole, clean, and what is in your area. So I'm Norwegian, but I don't eat lutefisk, and I rarely have lefse anymore, although I love it. Um, but he saw that if you were in Switzerland, or of course, of his travels through Africa, totally different populations with totally different outcomes. Um, the Seminole Indians in Florida, or the people in Peru. So the diets were vastly different, and they were eating whole, clean foods and living
Right.
whole, clean lives. But they all did understand they needed some animal foods. So the quantity of animal foods and the variety of animal foods was vastly different from one place to another. But everybody consumed some animal foods, and they consumed the whole animal, whether it's an
Right.
insect or a small rodent, as the Aborigines consumed. Um, but in that environment where every population lived, their diets were vastly different, but all of them included animal foods of some sort.
Mm.
So that's the thing that I just can't shake. The Eskimos had a very, very high, as much as 80 or 85% saturated fat diet.
Right.
And of course, it varied throughout the seasons and all of that, but they ate a lot of seal and whale blubber. They also ate seaweed and berries and things like that. And then the Maasai, mostly milk, meat, and blood from their animals. Um, Peruvians, guinea pigs and small deer and grains. There, I don't recall any population anywhere in the world that he looked at that only consumed one type of food. Their
Mm,
diets may their diets varied in variety,
right,
in
right,
breadth, but
right.
but it always was whole. It always was clean. It always was natural, naturally raised, naturally processed, not not canned,
Right.
not stripped. Um, but that animal food part is something that I just cannot toss out.
So
Again,
one of the things that I take classes, I love to learn, so I'm always
me
taking
too.
classes. I have a herbalist locally who's a master herbalist who gives classes, and I did a herbal class. And this year I'm taking how to eat for the seasons or with the
Mm,
seasons. So
good.
basically you have a season for spring, what to do, how to detox, then what to eat, and then you prep with teas and everything, and then how to eat for summer, and it's really cool because then you follow the Florida spring, the Florida summer, which is totally different than the north, like,
Virginia.
right, right, right.
Yeah.
And so it's really cool to eat our own foods in the right time, in the right season, the right teas and everything, and to grow your own herbal garden and everything.
Yeah.
Another thing too that I think is important to bring to everybody's attention is, unfortunately, they've, for lack of a better word, misguided, misled us for so long, telling us that fats were bad. I mean, think about it. That's what the brain needs, is cholesterol to
Yeah.
survive. The brain needed, the body needed salt. Celtic salt has 82 minerals, that including magnesium, that we desperately need to be able to function appropriately. So yes, there's a lot of stuff, unfortunately, that is, personally, do I eat meat? No, but I love butter.
Well, there you go. We
And then
we have
and I eat cheese, but I could only eat certain cheese because I can't do dairy. See, that's the other thing too. I eat for what works for me too.
yes.
Now, may not work for my daughter, it may not work for you, it may not work for somebody else. But there's certain things that I love and I do and I thrive on. And then I know there are things that I don't do well on. I don't feel good. So I avoid them. So
I
I think,
understand that, especially with so many people today having gut issues that they don't even always recognize. But if you have autoimmune problems, if you have allergies, it relates directly to the gut. Now, dairy, most of the people that Dr. Price studied, whether they were drinking reindeer, water buffalo, goat, sheep, or whatever type of milk, they were mostly consuming it in a fermented or cultured way, not
right.
fresh. And that makes it highly digestible and nutrient dense. So
Right. The
I'm
only
glad you're
one that I
using butter.
Right. The only one that I love, and I do a lot of kefir and I do a lot of fermented ones, is I do a lot of my fermentation. I know your daughter does fermented foods too, and we talked about
Mhm.
that. I love coconut milk, coconut kefir, coconut that,
Yeah.
and goat. I love goat kefir, goat cheese, and I go for the raw stuff. Um, every time I do dairy with cow stuff, even the A2 stuff, even to the whatever grass fed, whatever, my eyes scrunch up. I react to it and I get all mucusy too. So I know that that's not for me.
That's not good
And
for you.
right. So it's like I said, I think that's process of elimination. That's a mother who monitors their child and says, you didn't snort that much or drool this much or whatever when I gave you this food, but now you are with that food. And it's like, okay, then I always like to go, why? Why?
Yes. Yes.
Why? So each time you ask the why, there's always a deeper, deeper, deeper level down the rabbit hole. So that I think is process of elimination
Mhm.
intellectually and education. And I know it's hard because damn, I can't even find the time to say my name when I get home at night. I mean, we're so exhausted by the rat
Yes.
race, by what we have to do all day long. I mean, running a business, doing everything that you have to do, busy practice. It's like, okay, how do you find time to parent anymore? So
Uh,
that's where too I find the olden days where mom stayed at home, dad worked. Well, we did the role reversal. My ex was the dad. He was home with the kids, and I was the one that worked because I was the one that had a practice. So in that aspect, it's I think that's where the emotional component of the connections comes in. Is balance. There's always balance. So you ask how to create healthy children. I think the
Yeah.
emotional component is very, very important. There was a TED talk the other day I saw. I happened to show it on my YouTube feed. 5-year-old was giving a TED talk. A 5-year-old took a TED talk about the 5 important components for child and brain development. Well, there was nutrition, there was all the other things, but interaction. And so she showed the parent playing peekaboo, playing with the parent, the father playing with her little brother, doing all these things. And then within 5 minutes, he was on his tablet. And the kid started crying because no matter how much he tried to get dad's attention, he was ignoring the child. So, and then afterwards he was available, I think, but within another 5 minutes it was the same thing with animals, kitty cats and dogs, to where you give them attention, then you're on your tablet and then you show it. So it was two totally different things. But that's the I think that's the social interaction that
Hmm.
gives for healthy brain development, because we all learn by intercommunication and mirroring. So what you put
Yeah.
out is what you're going to get back. So if a child doesn't see that, no matter what you feed them, you've got some very, very healthy, sick-minded people. All right.
Yes.
So the whole idea is to go ahead and to feed the body, the mind, the soul, and the spirit, to where you give them good foods, but you also give them that love, that communication, that interaction, that commitment of time and growth. So yeah, I think that's
And
important too.
stay
I had to put
stay
that in.
off of these and stop giving your children the phone, the iPad, the whatever. Yeah, they really kids cannot grow and thrive when they're connected to a device constantly. You're
So
right. I'm glad you
a
brought
lot
that up.
Right. A lot of times, so for example, I'll go ahead and I'm interviewing for a dental assistant, and I'll go ahead. These kids can't communicate with an adult. They can text, but they can't talk to you and look at you in the face. They just never been taught how to. And that's
Isn't that
sad.
sad? That is sad. And not to have parents who are invested enough. I
But the
understand.
parents grew up that way too, because they didn't have it. So the apple doesn't fall far from the tree. So, you're one in a billion, that you had your philosophy, you had your upbringing, you had your goals, your aspirations. Your daughter is a shining example of the love and nurturing that you've given her. I mean, you could just see it in her. She radiates this peace, harmony, and health, you know. I mean, not
She
everybody
does.
has that. Not everybody has
No,
that. And it's
she
those
really
that
does.
and it's those that have it, that have been blessed with that can share it. And then there's those who've been through the trauma, who don't have it, who've reverse engineered the trauma, and the have nots, that then could go ahead and share their experiences, and then the two meet halfway to help all the others.
Yeah, yeah,
So
that's true.
that's where too, when I wrote this book, come back again, smile, it's all
Yeah,
connected.
we're going to put a link in the notes so that people can find it easily.
When I wrote this book, I told you it took over 10 years to get this book done, and
Yeah.
out there, right? It had been edited by at least 5 or 6 times. Every single person that edited it told me, literally, and they were all mothers, told me that they used it as a reference book for their families when they needed to have something answered. And I said, "You did?" They said, "Yeah, I did it." Blah, blah, blah. I said, "Which job? What? How?" I said, "I did my job."
Good, good, and you're doing it
It
very
worked.
well. Yep,
Yeah, thank you.
you're
Yeah, it's
inspiring.
thank you.
And
It was my way of trying to help people get well, understanding that nobody's going to do it for you, but if you can understand how it's all connected, So all the things, because there's a big section nutrition, by the way, in the book.
Yeah.
All
Yes,
the
I know that. I saw
vitamins,
that.
all this, yeah, what to do naturally, what to avoid, why to avoid those things that everybody says is okay, that not really are.
Yeah.
So, but not politically. It's not a political book. It's just facts. Is these are the facts. This is what's what. You can have it. You don't have to, but it's you're there for you to peruse and to understand. My goal was to change the way that dentistry is perceived and performed. And if a mom understands how it's all connected and how you can grow healthy bodies, all right, and she wants certain things for her and for her child to be healthy, right?
Yes.
If the demand is going to change, then the supply has to change too. So the goal is to have the demand ask and say, hey, this is what I want. And then they'll bring it back in the schools and the doctors will learn. And hopefully, sooner than that, the doctors who want to know how to provide this type of services that doctors like me do, then we'll go ahead and we'll be able to teach them and show them the way. It's like, this is how it used to be. This is how you can do it. It's very simple. Just pay attention to what the body says. Help the patient read their body because the patients already know what's going on, what's wrong.
Yeah.
They come in, they already know. You just have to ask the right questions and go ahead and say, just like Tony was saying, Dr. Stagg, who was his mentor, went ahead and he was the one. So this is interesting because Tourette's, usually it's the little kids, the 4-year-olds who have the symptoms, right? Well, Dr. Stagg was preparing his lecture for his peers on TMJ disorders. Now, Dr. Stagg was an orthodontist, and he found when he was helping his patients heal their joint disorder, how they did in the American Academy of Craniofacial Pain Institute, which I have my residency in. So when he found that out, he found, wait a minute, a lot of their motion disorders were going away. And it's like, okay. And then they did the research, and Dr. Sims joined forces with Dr. Stack, and they did publish 2 papers, which are on my website. And that's when they
Oh,
found out that it had to do with the auriculotemporal nerve, which is a little, the 5th cranial nerve, which is part 1, part 2, part 3, which is back to our little parts again,
yeah.
which is why us dentists are so important in this whole body thing, because we actually are neurobiological engineers. That's what Dr. Alfonda said, is that we are the mothership, we're the motherboard, we're the whole CPU of the whole system. Once this part, nutrition's a little piece of the whole thing, all right? But Weston Price already figured that one out. And he and many others were cahoots. They were good friends. All these guys were good friends with each other back then. And they
Yeah.
all did their research, their own thing in their own wheelhouse, but they were all concomitant and they talked with each other. So what happened is you had this whole community of knowledge and mastery of humanity, if you will, that was out there. And then we lost it. They
But
threw
we
it away.
have
They
it,
threw it away.
but we
It's
can go
back.
back
It's
to
coming
it
back.
through. Yeah, that's my
So
point.
so that's what's in this book. It's like it's all out there. It's there. Now you could find the pieces that suit you. What is it that works for you? What is it the parts that where you fell through the cracks? Where did you go down your rabbit hole? Remember the little pieces of furniture that were in the way?
Yes.
What pieces of furniture are yours that are not where they're supposed to be? Nutrition is a big part. It definitely is.
Yes.
The structural aspect is a direct correlation with the nutrition part. But if you don't have proper structure and proper nutrition, you're going to have problems with function, problems with mechanics. And when those are not working, you're going to have problems with the emotional part. Then you're going to have problems with the spiritual part, because you're going to think like, oh my God, why have you forsaken me? Kind of thing. I was like, the despair, back to despair again. So have faith. It's all good. It's all going to work out. We're on the right track. I have faith. I'm usually, people will tell me sometimes, yeah, you always see things half empty or whatever. But in reality, I see for certain things, like when, mothers, we worry. All right. We worry. We
Yes,
worry
we
about our
do.
kids. We always will, because that's how it is. And okay. So sometimes I worry more than I probably should. And then I'm getting to the point in my life where I'm thinking, okay, I can't do that. Like you said, I can't control that. They've picked their journey. I've picked mine, and all I can do is be a good example. And now that's when I was telling you my new mantra is I trust. I trust. I trust it's
Mhm.
all going to work out. I trust it's all going to be good. And I trust God has a higher calling and it's all going to work out.
Yeah.
And the light is one. It's all good. It's all good. It's all good.
And Claire, you are a fine example of the answer to the puzzle, and that is just like Dr. Price said, you teach, you teach, you teach.
Right.
Our mission at God's Good Table is the same as your mission in your practice and with writing your book. We want to help people to regain, restore, maintain, and build whole health. And we tend to focus a lot on nutrition because that's in my mind, that's one of the biggest parts that we have control over. But it is about much more than that. It's about
Right.
emotional health. It's about dealing with trauma. It's about movement. It's about gratitude, giving, and all of that. And so you've been very giving today, and I so much appreciate it. I'm not in any way disappointed in our conversation today. You are a delight and an inspiration, and I hope that our viewers feel the same way, and I'm sure that they will. Um, I'm just so very thankful for you. Before we close, would you have anything, a last thought?
I think Dr. Price's book, this one, is
Yes,
worth it to read.
yeah,
You all probably know it a lot more than I do. I sort of deep dove a lot more into all his other research, and
yes.
I was very surprised to find out that it's on the wide web for free. His entire research is on the web for free.
I didn't even know that. Price
Yeah,
Pottinger archives all of his and Dr. Francis Pottinger's material. I knew a lot of it was out there, but I didn't know that it all was the thousands and thousands of pages of research, and it
right,
goes
right,
beyond what we've talked about today.
right.
Some of it I'll touch on at a later date with others as well, but it's fascinating.
All this is also discussed in the book, by the way. The focal point
Okay.
of infections, the different bacteria. I mean, my dad died of bacteria. Well, he had an artificial heart valve and he died of congestive heart failure, but he also had systemic bacterial endocarditis, which was because of the bacteria from a failed root canal. So close to home, close to home. I
Yeah.
know about it all. So it's, it's a choice. It's all personal. Just be making an informed decision. I mean, but that's what the book is. It's like a mini textbook for the lay person, one mom to another. It's a book for moms written by a mom, explaining everything you could think of that starts right up in here. It's right up in here. This is my wheelhouse: body, mind, soul, spirit, structurally, chemically, mechanically, functionally, emotionally, spiritually, past, present, future. It's all in there. It's all in that
All
book.
of
It's
that.
a labor of love. And I really do believe it's God's work. I gave of self. I gave of self to help others.
Clearly, I can see that, and we're grateful for that. Claire, our time is up, but it has just been
Thank you.
absolutely delightful to talk with you. Everyone, we have links up so you can find Claire, you can find her book, and you can ask more questions too.
If ever you feel that you would like to talk again, I would be more than happy to. And then you pick the topic, just give me advance notice and I'll talk more.
Okay, I'm sure we will be doing that, and thank you for that offer, and thank you for today. It has been absolutely delightful. And we're
Thank
going
you,
to sign
Maureen.
off. You're welcome. Thank you. I know that all of our viewers are grateful as well. So,
Thank you.
um,
And then make sure that tell Erin thank you for me too.
yeah, I'll tell her. All right. Well, everyone will be back next week for another recording, and have a good week until then. Bye bye.